My name is Ann Brazeau. I'm the founder and CEO of MPN Advocacy and Education International. And we are so thankful to all of you for being here. We are extremely interested and focusing much of our time now on pediatric and young adult MPN and those young people with myeloproliferative neoplasm. You will hear from some parents in this room and a few patients, and you will learn and understand what it's like from the parent perspective to have their child get an MPN diagnosis, but also from a young adult who is the patient. And you will also hear from 3 MPN, pediatric and young adult MPN specialists, and their presentations, I hope, will be enlightening and empowering for all of you. I want to, at this time, thank our sponsors. We had many sponsors, but one who is present right now, who we partner very often with the MPN Research Foundation. They are my other half of my family, basically. I'd like to introduce Michelle Worley, who is the executive director at the foundation. She's done an amazing job. I'm real proud of her. I know she gets sick of hearing me say that, but I don't care, because I worked there for a long time, and she was my right arm, and I'm just really proud that she's in that position now. So if you have any questions for the foundation as well, please ask. And so one of the things Kathleen and I and our scientific advisor, Dr. Messa, and our partner now, Dr. Cousine, who is the pediatric specialist, I'm going to break off a little bit from my presentation because one of the moms in this group, Sarah, and we were chatting yesterday evening briefly, but you said something that really resonated with me, and that was, the specialists are only seeing maybe 20 patients, 20 young patients, and it's very true. But we know there are more children and young adults with an MPN. So we get a lot of hits on our website from other countries, South America and Mexico, being some of those countries, and we're starting to really build a database of young people around the world. And so it is possibly cause for alarm, I would say, to at least be paying attention to this, and we are going to focus more of our attention in this area and be there as a support system for you. So, as I said, I used to work at the MPN Research Foundation, and I'm proud to say that I learned much of what I know today from that place. Bob Rosen, who is not with us anymore, sadly, was just an amazing man, and I had a great time working there because Barbara Van Heusen was basically my go-to person, and Michelle was with us, and I don't know, I'm sure Michelle could echo this, but when it came to patients and came to what do we do next in research, it's cutting edge research, and we were just allowed the freedom to go after it. Whatever seemed important and pertinent at the time, we went after it. And I've kind of brought that with me into this organization. We look at what is needed in the MPN world, not so much in research, because that is their field and their expertise, but in education and advocacy. And so we had the Women in MPN program yesterday, which that initiative has just been wonderful and has brought us in touch with so many women across the globe who are so happy that we're doing this and focusing on these differences. And of course today, pediatric and young adult programs, this is our first one. We're hoping to do this annually, and we're hoping to get the parents in the room and even the people that are the young people diagnosed with MPNs more involved. And we do a program, some of you heard this yesterday. We're working with Vietnam vets who were exposed to Agent Orange and have an MPN, and we believe that it's very much related, and so we're trying to get MPNs on the Veterans Administration's presumptive list, which presumes their MPN was a direct cause from Agent Orange exposure. And we also, part of the work that we're doing in that area is it's a jump-off place to look at environmental issues and MPNs. And then our partnering initiatives, of course, our major partner is the Research Foundation, but other organizations that are part of our family, and including LLS and the National Organization for Rare Diseases, those kinds of places. Our goals and commitment are to assist, direct, and inform all of you on pertinent issues that impact you in all ways. Quality care, if you are not receiving it or your child is not receiving it, let us know, and we will do what we can to direct you to the proper resources. If treatment access is a problem, let us know. We will do our best to help you out. The current research and clinical trials, we have all that information on our website, and the foundation does as well. And I mean, there are many, many resources that are available today that were not there when I first came into this arena in 2005. And then our advocacy efforts, we are there for you. We'll go to bat for you in any way we can. And of course, provide the resources. If we don't have them, we'll direct you elsewhere. I'm going to skip over some of these. We know, obviously, sitting here, that the average age used to be 65, I think, and that is no longer true. It keeps dropping, and I think the average age now is 40-something, but that's even dropping. Oops, sorry. The life expectancy is just, it's almost a conversation that we rarely have anymore, because people are living long, fulfilling, great lives with an MPN. The treatments are changing constantly. There are more treatments in the pipeline. There's so much more knowledge about MPNs that it's just mind-boggling how much is out there. So take advantage of the information that's there, whether it's through us or other organizations. Take advantage of it, because there's a ton out there to learn, and there's a ton of available resources. Sorry. So I really wanted to focus today. These are just the places we're going next, but I really wanted to focus today on all of you here and why you're here. And I'm very open to any suggestions that you parents may be thinking about that you may need from us. Do not hesitate to ask. We will do whatever we can to support you. I know some of the parents in this room have been doing this for a long time and working in this area for their children and advocating for them for a long time. And if there's anything that that you think would be of great importance and helpful to other parents, then we need to hear from you, and we will try to assist in getting that information out.